We know that multiple myeloma is a unique disease in the African American and the Black community, really for many reasons. Primarily, the disease is twice as common in Blacks than it is in Caucasians. We don't fully understand all of the rationale and the understanding of that, the science behind that, but we know it's just twice as prevalent. But what's perhaps most disturbing is that despite knowing that it is twice as common, it is often not recognized and not recognized in time. The average time to diagnosis from the onset of symptoms to an accurate diagnosis is significantly longer in the African American community than it would be in the Caucasian community. And that's an unfortunate reality. And that, along with the treatments that individuals have access to. We've learned, unfortunately, that African Americans are less likely to receive triplet therapies or the combinations of chemotherapy that are so important. Transplant, that we know is stem cell transplants, are very important in the treatment of myeloma, and access to clinical trials. African Americans constitute somewhere between 17 to 20% of all myeloma patients in this country, but actually only reflect about 5 to 6% of clinical trial participation. And all of that has led, unfortunately, to an inferior survival rate in African Americans compared to Caucasians. We've seen huge advances in survival in myeloma over the last decade. But for every 1.3 years gained by Caucasian patients, we've only seen 0.8 years gained in Black patients. So this is a disparity that is disturbing and that we need to address. The disparity in multiple myeloma is honestly not only confined to the African American community. We see this in many other vulnerable communities, in particular the Hispanic community, where we know that the disease is diagnosed at a younger age than we would typically see in the Caucasian community. Also reflective of the healthcare system in our country, where many patients of a Hispanic background have less access to healthcare, and this clearly influences outcomes. And so as we study this more and appreciate it more, we come to understand that there are many vulnerable populations by virtue of race, by virtue of insurance status, by virtue of documented status. All of these things, unfortunately, have a significant impact in a patient's survival with multiple myeloma. COVID-19 has really affected so many things in the medical community, but thankfully, one of the things that we have not significantly seen, apart from, for a period of time, reduced access to clinical trials, we have been able to maintain the supply of our key agents and treatments that we use in multiple myeloma. So I'm very thankful that I've not had to delay or cancel my patients' treatments by virtue of a supply chain issue. We're very grateful that that supply chain has pretty well been maintained throughout the pandemic, and we trust will continue to be maintained.